Hello everyone, this is Major Robert Wittwer coming to you from frigid Dayton, Ohio, and today I'll be presenting my evaluation of emerging mobile technology applications for healthcare. For this project, I chose to evaluate the Heart-to-Heart network, which provides connected care anytime, anywhere, with its home office located in Fairway, Kansas. The Heart-to-Heart network was founded in 2011 by Chief Executive Officer Abby Ray. Mr. Ray graduated with an MBA degree from Maryville University in St. Louis, Missouri, and holds a master's in medical informatics and a master's in healthcare administration from the University of Missouri, Columbia. So to meet the rest of the leadership team, the Chief Scientific Officer is Dr. Stan Edlovich. Dr. Edlovich has a PhD in epidemiology, master's in public health, and master's in mathematical statistics. He is a professor of epidemiology in the Department of Psychiatry at the University of Missouri School of Medicine. The VP of Business Development is Mr. John Fitzpatrick. Mr. Fitzpatrick has a bachelor's degree in Government and International Studies from the University of Notre Dame. Dr. John Lewington is the VP of Global Business. Dr. Lewington has a PhD in Database Marketing and a master's in Business Management. He has served as Director of Management Studies at Harrow College in the UK and as the Dean of the Business School at Maryville University in St. Louis, Missouri. And the Chief Medical Officer is Dr. Atul Patel. He is a board certified in PM&R, spinal cord medicine, neuromuscular medicine, brain injury medicine, and electrodiagnostic medicine. He has a medical degree from Baylor College of Medicine in Houston and a master's in both rehabilitation medicine and health services administration. The goal of Heart-to-Heart is addressing deficiencies of the current healthcare system with a connected care framework. Their innovative technology provides real-time transfer of physiological data combined with data on psychosocial health to create a virtual snapshot of the patient in their home environment. They have established a collaborative framework of increasing communication, coordination, and collaboration in providing service and technology to deliver whole person management using a patient-centered approach. The care management process includes assessment of services needed, coordinated care planning, 24/7 access to information, monitoring of patient health information, and appropriate and timely intervention. So the way it works is pretty simple. Healthcare information is shared between patient or caregiver to the remote patient management team via a wireless network where the care coordinator can then provide appropriate and timely information back to the patient and caregiver for self-management. There are a number of ways in which patient data can be sent to the care coordinator. For example, Bluetooth-enabled medical devices upload data like blood pressure, oxygen saturation, and weight to the patient's digital hub on the Access to Care app, which is accessible from a computer, tablet, or smartphone. The information is then automatically transmitted to a secure HIPAA-compliant server, which is then sent to the patient management's team dashboard on the Access to Care app, which is also accessible from a computer, laptop, or smartphone. Other data can be manually entered into the patient's Access to Care app, such as blood glucose, symptoms, pediatric intake and output, as well as video recordings. So how do patients and providers use this technology? Well, patient services include senior care and continuous health management with simple-to-use devices and the patient's Access to Care app called the Digital Hub. The continuous health management includes a comprehensive assessment from a care coordinator to determine the individual's level of services needed. A care coordinator who ensures that the individual's care support group, network of family, provider, and friends are current on an individual's healthcare needs. A daily account of clinical record and personal health information is available in real-time 24/7 platform and through Bluetooth-enabled medical devices which automatically transmit blood pressure, pulse oxygenation, and weight through remote monitoring devices. Patient and caregivers can connect with heart-to-heart in 4 ways. Individuals can call the care coordinator whenever they need support, whether it's for a serious medical issue or a simple medical question. Individuals and members of the care support group can email the care coordinator or enter important data at any time using the secure app or website. The care coordinator is always in touch with the individual throughout daily reminders and phone calls and communicates with the family as necessary. Remote monitoring of Bluetooth-enabled devices track important, objective data in real time. Senior care is best described as an electronic triage which provides remote monitoring and access to care 24/7 for help with simple questions or for help navigating treatment protocols. Providers can perform remote patient management, pediatric home monitoring, and chronic care management via the dashboard on the Access to Care app. Patient-specific protocols are risk stratified and prioritized into an efficient workflow for the clinician. The remote patient management feature provides real-time transfer of physiological data combined with data on psychosocial health to create a virtual snapshot of the patient in their home environment. Care coordinators collect and analyze data, historical and real-time clinical and behavioral data, triggering clinical protocols and guidelines which provide appropriate and timely intervention or educational resources with user-friendly display of physiological data to support better treatment adherence. Patient questionnaires are designed to assess specific health risks. Patient-specific alerts occur when data goes outside the defined patient parameters. The organizational dashboard provides data displayed within patient-specific parameters established by the clinician, tailored protocols to meet disease conditions so a caseload of several patients can be easily managed. Patient clinical summary includes monitored conditions such as diabetes, hypertension, CHF, and COPD, and levels for each condition, such as blood pressure, weight, glucose, and blood oxygen. Assessment documentation function highlights a broad range of patients' pertinent health information. Pediatric home monitoring provides ongoing remote monitoring, providing clinician with multiple physiological parameters, helping to augment care for pediatric patients after surgical interventions or complicated medical diagnoses when outside the acute care setting. These features include intake, output, Bluetooth-enabled weight capture, Bluetooth-enabled oxygen saturation, and a video feed. And this data is interpreted by the care coordinator who provides specific treatment protocols or educational resources for the caregiver. Chronic care management is similar to the remote patient monitoring feature as it provides a patient clinical summary with modifiable parameters and alerts for blood pressure, blood glucose, or blood oxygen levels. A physician assessment enables providers to tailor treatment, personalize medical care, and facilitate the patient's self-management. Alerts if values fall outside established parameters. The ability to record clinical notes integrated within a medical electronic record system, and provides delivery of questionnaires to capture psychosocial data to provide a more complete picture of the patient's health in their home environment. So pros and cons for this healthcare application. For the pros, all of the information is safeguarded in a secured website accessible through any electronic device such as a computer, laptop, tablet, or mobile phone. It provides access to a care coordinator 24/7 for help with simple questions or with help to navigate treatment protocols. I like the idea of improving compliance and goal-directed therapy with medication, data input, and appointment reminders, particularly for elderly patients with caregivers or for those patients in rural areas with a decreased access to healthcare. And in all, this technology has the potential to improve access to care, reduce cost, and improve patient outcomes. Now, regarding the cons, first of all, if the heart-to-heart services provided is anything like their website, I would be cautious. Not that this assignment calls to evaluate the website, but it's not entirely informative and it is very inconsistent in its functionality and design. For example, the link to their homepage is either a dead end, for example, or the link to the YouTube, also a dead end. Second, the full functionality of the service is dependent partly on user input. So if compliance is a concern, the benefit of this technology is lost. Also, and this is my biggest con, they don't demonstrate any evidence supporting efficiency, effectiveness, improved compliance, cost reduction, or improved patient outcomes, but yet they claim their programs are validated by experts in the field. I think they need to substantiate their claims with more supporting evidence. Also, the technology platform is dependent on a care coordinator or a case manager, but they do not specify who that person is or what their credentials are. Some parts of the website make reference to doctors or nurses, but provide no information on the healthcare team. As far as cost, one clinic kit costs $1,500 a year, and it includes a tablet, blood pressure monitor, a weight scale, pulse oxygen monitor, user support, and access to care app. However, this does not mention the patient payment portion or any applicable insurance coverage. So how could this technology be improved? Well, I think, first of all, their website could use a lot of TLC, including a bit more technical information and credentialing as far as their providers. They mention patient-specific alerts in several different applications, which notify healthcare coordinators if data goes outside defined parameters, but it doesn't mention if this feature has the ability to automatically contact the patient or to notify EMS if data suggests a life-threatening situation, for example, glucose less than 30, or oxygen saturation below 50, or blood pressure of 240 over 120. Also, it would be beneficial if it could incorporate a prescription renewal system that talks to the patient's local pharmacy for medication refills. And lastly, I feel like they could capture a much needed mental health population with some of their above mentioned monitoring plus daily push notifications and questionnaires to assess patients for their mental illness symptoms. So that wraps up my presentation on emerging mobile technology applications for healthcare. I hope you enjoyed the video. Thank you and have a great day.